We've been discussing this morning, a new report from the British Medical Journal has called for the government to declare a national health and care emergency.
We are joined now by co-author of that report, former Chief Executive of NHS England, Lord Nigel Crisp. Thank you so much for joining us. Explain, because I think we've heard so many times, look, there's an emergency facing the National Health Service. Why is there an emergency? What is causing it? And when you want there to be a radical overhaul, how so?
Well, let me explain that this is not just about the NHS. The NHS has got major problems, and we'll talk about that, but it's also about the crises in the community, the obesity, the fact that poor housing damages people so much. And it's also about the economy, because frankly, we have got a situation with an older population, an aging population, but also increasing illness of people all over the country. And that's affecting our economy. So it's for all those reasons that we're saying that a new government of whatever colour that comes in should declare a national health and care emergency. And it should bring people together. And that includes people like housing providers. It also includes people like the food manufacturers and so on, as well as the NHS staff, to actually work together to solve the problem. And it will take time. But there's a great deal of goodwill around the system. The NHS is in crisis, as your caption just says. Let me just say that there's an awful lot of good care still provided in the NHS. So let's be very clear about that. But for far too many people, they don't get the care they need or their relatives need. And there's all kinds of difficulties of a service that's being swamped. So partly what we're talking about here is about taking some of the pressure off the NHS by dealing with some of the things that cause a lot of that illness and cause a lot of that problems. So it's, and that's why we chose the idea of a national emergency, because actually it pulls people together. It's all hands to the pump. It's how do we get ourselves out of this problem that we're in?
Lord Crisp, this sounds like a massive overreach on behalf of the NHS and the healthcare sector. People don't want to be thinking about this element of what they should or shouldn't be doing every day of their working lives. And using terms like national emergency, surely that's far too emotive for what should be a practical solution to the problems you describe.
We're actually trying to get attention here. And we obviously have got, so thank you for putting us on the programme. But my point here is that it is a national emergency because actually the NHS will cure people and then send them back to the conditions in which they become unhealthy, and then they come back into the NHS. So this isn't about people telling people how to behave and so on. It's about our appalling housing system, which all too often at the moment creates ill health. And it does that in a whole range of ways. We saw that poor child in Rochdale who was killed by damp in their home, by mould in their home. We saw another poor child in London killed by air pollution in their home. And there's an awful lot that we need to do to ensure that our housing promotes health, safety and well-being. And then turn to food manufacturers and a lot of the problems that come from very unhealthy food, particularly for young children. So actually we're calling it an emergency to bring people together. And the government can do that. A new government coming in, whether it's this one in a new guise or whether it's a different government altogether, with the time to make the changes that are necessary.
Some changes in the NHS, Lord Crisp, are already being made. We've had the smoking ban announced just this week. We've just been live at a pharmacy where pressure's going to be taken off GPs because pharmacists will instead be taking up, I think, freeing up about 30 million GP appointments. You know, there are some strategies. Presumably you think those are good ones. They might help, they might work.
I think both of those are good strategies. I think I think both of them could go probably a bit further in terms of, but the pharmacy one is great. Provided we're sure that it needs to be checked, it needs to be followed through and evaluated. But it looks as if it's going to be a good policy for making sure that we use assets in the community to promote health.
So I think some of this
this isn't an NHS takeover.
Yeah, some of your report is quite broad and lacks the specifics, maybe, like some ideas. Are there other things that you think we could obviously do, like the smoking ban or the pharmacist, that would be some kind of quick solutions that would say, right, we can definitely see we can be more efficient there and the public's health will benefit? Sugar tax, ideas like that.
Well, I think the two things immediately come to mind. One is we do say in the report, and this is an introductory report. There are other reports to come from the BMJ Commission, but one is that there needs to be this massive transition to much more care in the community, and the pharmacy is part of it. But it needs to be part of a bigger strategy, which means that we have to invest in primary care and that's giving nurses bigger roles in primary care as well. But we also have to invest in social care, and as you know, that is a real problem at the moment. So there are some very specific things that need to happen within the NHS. And then outside, last year I introduced a private member's bill about healthy homes, which is why I'm talking partly about housing now, and indicating that actually we need to ensure that our homes are well insulated. We need to ensure that there's access to green space for people outside, and we need to ensure that they have windows. We need to ensure there's enough space and that there's not overcrowding. So there's a whole lot of things that need to be done in terms of inside the NHS and outside the NHS, but it needs to be part of a coherent plan. And if I talk to my friends in the NHS now, they talk to me about the pressure, they talk to me about a lack of hope and a lack of vision. And I think a new government coming in will have the opportunity of a change to sort of set out what they're going to do over a 10-year period, let us say. 5 years in the first instance, no doubt, in order to move us back from a situation where we are becoming unhealthier and unhealthier as a nation.
OK, Lord Crisp, we're going to have to leave it there.
Care.
But thank you very much indeed. That's Lord Crisp, who is one of the co-authors of the BMJ Health Emergency Warning Report.